Zedek. My name is Uri Schwartz. I'm the head of our resource development department. And it's really a privilege for me, for us to host this evening with Professor Yonatan Halevi, our former Director General, our current President. The truth is that Professor he is in New York on a very short visit. I'm sure he'll tell you about that. But we're delighted that we tonight can tell you a little about the COVID-19 vaccines. The other Zooms we have had have been like without any real hope, or without being able to see any ending. And now at least, even though the situation also in Israel is getting pretty bad, at least we can now see the light at the end of the tunnel. So without any further ado, I would like to transfer the words to Professor Halevi. I would, however, like to say that since we are so many people online, at the moment we are 230 and people are still joining us, there will be a chance to ask questions at the end of Professor Halevi's talk. And please, I would suggest that you put them in writing and we will then answer the questions from what it says there. It will be impossible that everybody will talk at the same time. So without any further ado, Professor Halevi, bevakasha.
Thank you very much, Uri. So good morning, good afternoon, and good evening to all of you, wherever you are. It's really a pleasure to see now close to 200 people who are joining us today. And it's really my pleasure to talk about the vaccine that is of interest to everyone. And I will start by naming the topics that I will try to cover, each one of them very briefly, about the vaccine, and then we'll open it for question. So we will talk about messenger RNA, what it is and the role that it plays in the Pfizer and Moderna vaccines. We'll mention other types of vaccines. I will relate to the speed in which this vaccine was developed and why we should not be afraid from it. I will talk about the spike protein. This is the protein in the virus that serves the virus to penetrate the cells and how the immune system fights it after being elicited by the new vaccine. I will relate to fake news that we are all exposed to about the vaccine. I will try to allude to the length of effect of the vaccine and how much immunity the disease itself confers when one had already the disease. And I will definitely relate to Israel and how it came about that we are leaders in vaccinating our population, despite the fact that we are slowing down a little bit in the next couple of weeks. I will also relate to the fact, does the vaccine prevent the vaccinee from being contagious? The answer is we don't know, but I will expand a little bit about that. And of course, everybody is curious about getting the vaccine if one already had the disease. So I will try to cover all these aspects in the next 45 minutes or so. I hope that will answer in an early way, answer some of the prospective questions. But if you still have questions afterwards, I'll be glad to answer. So what is messenger RNA that everybody is talking about today? So I think we all heard about DNA. DNA, the code of which was deciphered in 2000, so it's already 20 years, is a group of nucleic acids, like chemicals, that are responsible to produce proteins in the body. Proteins in the cell are the workhorses of the body. The proteins are responsible for all our metabolic functions, actually every physiological function. Between the DNA and the proteins that the DNA is responsible to produce, there are two mediators. One of them is the messenger RNA, and it's important for me to explain this basic physiology because one of the main concerns is will the messenger RNA, mRNA, do something to the DNA and change our genetic code, our ability to bring children to the world, to become pregnant? The answer is no. So you should look at the mRNA, the messenger RNA, as one of the two mediators. The other mediator is a structure in the cytoplasm of the cell. Cytoplasm is the part of the cell that is outside the nucleus. It's called ribosome, and the messenger RNA engineers the ribosome to produce protein. Now, it was found very early on during this epidemic by the Chinese, not only the genomic constituents of the virus, but also the fact that what is dangerous about this virus is that it penetrates the cell with the help of one protein. You all heard about it, called the spike protein. The spike protein just connects to a certain receptor on the membrane of the cell. The receptor is called ACE2, angiotensin converting enzyme 2. This is not important for you unless you are in the profession, and that's how it attacks the cell. So what does the vaccine do? And I'm talking now about the messenger RNA vaccines, because these are the two early vaccines that were developed by Pfizer, by Moderna. They are the same technology, same minimal complications, and I will try to explain why the complications are really minimal. And the traditional way of putting together a vaccine by just attenuating a live virus or killing the virus or engineering another virus to carry a molecule that will stimulate our immune system to fight the virus. These are not part of the Pfizer and Moderna vaccine. The Israeli vaccine, for instance, is an engineered virus, adenovirus, that carries part of the genome of the COVID-19, and that's how it stimulates the immune system. It's a completely different technology. We will not discuss it today because what there is in the market today are Pfizer and Moderna. AstraZeneca got initial confirmations now, especially in Europe. It's also an engineered different virus, but I want really to relate to the messenger RNA because all the 287 people that listen to me now, some of you in couples, so it's probably over 300, already got or about to get one of these mRNA vaccines. So many of you, many of us are bothered by the fact that we read everywhere that traditionally it took 5 to 10 years to develop a vaccine. And here we have a vaccine with a new technology, first in human, unheard of, the mRNA technology, and it was developed within a year. Should we be concerned about it? My answer is definitely no. A, it's not in 1 year. The mRNA technology brought to the world by the two Turkish immigrants that immigrated to Germany many years ago in the early 70s is already under experimental efforts to produce vaccine out of for at least 2 decades, probably more than 2 decades. The fact that it took less than a year since the beginning of the epidemic to complete these efforts that were not completely fruitful so far until the beginning of 2020 is the fact that governments, and I have to commend especially the American government, but not only, and President Trump, influxed a lot of money, billions of dollars, in the shadow of this horrible epidemic. A lot of money was given, so money became no problem. Hundreds of laboratories and scientists around the world were recruited. A concerted effort was invested, and that's how we see ourselves 9 to 10 months after the beginning of this epidemic with a vaccine. So nobody should be worried from the fact that corners were cut. You all heard the FDA. It's true that when 3 months ago, or 3.5 months ago, Pfizer and Moderna published their phase 3, the results of their phase 3 trials one of them 30,000 people, the other 40,000 people, which was very convincing, 94.5% or 95% success in inducing immunogenicity against the virus is a major success. But, there is the stock market. We suspected Pfizer and Moderna, they would like their shares to come up very quickly, which really happened. But I rely on the FDA and the European authorities. The FDA scrutinized their experiments very, very thoroughly by people who are internationally recognized for their expertise on vaccinations. All of them are totally unbiased with no conflict of interest, and they confirmed it. What's more, since the emergency use authorization, the EUA given by the FDA, and when you ask yourself, why did it have to be an emergency? So anything that is being done in the shadow of such epidemic is called EUA. It's not much different than usual. It was very thoroughly scrutinized, and when you read the data, you can really be convinced. And what's more, since this EUA, the emergency use authorization, was given by the FDA, I think a couple of months ago, we already have around the world close to 6 million, this is the last publication, 6 million vaccinees. So while these vaccinees, only few weeks elapsed since they got it, and maybe we should be concerned for longer term complications, and in a minute I will explain why we should not be. If you take the 70,000 participants in the phase 3 experiments by Pfizer and by Moderna, they are already 4 to 6 months after the vaccinations, and we didn't hear about any serious side effects. I will relate later to the cases of allergy, to the case in Israel of a very old patient who had resuscitation, cardiac resuscitation, 2 weeks before he got the vaccine, and he expired an hour after he got the vaccine. It was also heavily investigated. There's nothing to do with the vaccine. So, after this introduction, I really want you to have faith in the authenticity and even the honesty of the publications, not the fake news, about the efficacy and safety of the vaccine. And I believe that everyone should get the vaccine, because this is the only way to mitigate this epidemic. I look at your faces, there are a few youngsters, and I don't want to insult anyone who doesn't look a young chap. I myself belong to the very risky risk group of patients, but I really want to appeal to those of you who have some background diseases. I'll talk about allergies in a minute, and they are taking many medications. You should not worry, and you should take the vaccine. The only side effects described so far, and as I said, we are talking about 70,000 people who are already close to 6 months after getting it, and close to 6 million people who are between 4 and 2 weeks after getting the first shot. And the only side effects were local side effects at the site, sometimes some fatigue in the 48 to 72 hours, very rare, by the way, but when we all get, I'm also between the two injections, when we all get the second, there's some more side effects than the first shot. So maybe there will be some more fatigue, maybe low-grade fever, no significant complications. And in a minute, we'll discuss fake news, but before that, I would like to talk about those who are still hesitating to get the vaccine, and they say to themselves, I'm 25, I'm 30 years old. If I get COVID-19, I'll probably be mildly sick, so I will join the herd immunity by this, and I should not get the vaccine, I should not take the risk. I want to say to these people that although I'm talking quite confidently about the vaccine, its efficacy, its safety, there is so much that we don't know about the virus. We at Shaare Zedek are in the midst of a third wave that is much worse than the first wave. Although in the first wave at the peak we had 125 patients, but many of them were mild cases because this was before the time that the sick funds, the medical insurance in Israel, could treat mild patients at home. I'll tell you how we deal with it in Israel when we talk about how Israel did so well and does so well with the vaccine. But today we have in Shaare Zedek 95 people, most of them severe, 19 of them on respirators, 39 of them are defined as in severe situation. And yesterday we lost a 40-year-old patient, mother of 8, working in our delivery room, and she had no risk factors at all. No risk factors at all. Thin, slim, no diabetes, no hypertension, non-smoking, no background lung disease. So here and there, this virus that misleads all of us picks as a victim someone that according to our severity score should not be there. And that's why in the name of these losses, and also because we have a societal commitment to reach herd immunity as fast as possible, I think that everybody should be vaccinated. I hope the logistic problems and the supply problems will be solved everywhere like they were always solved, not almost solved, not completely in Israel. I have no doubt that with the tempo, with the pace of production, by Pfizer and Moderna, of vaccines on a daily basis, until mid-2021, there will be vaccines for everybody. And of course, the high-risk group, those who are above 60, 65, with relevant background diseases or without relevant background diseases. And younger people with relevant background diseases should be the first together with the medical personnel. And I believe that if we want to continue leaving schools open, and I am all for it, also the teachers should be high priority in getting vaccinations. As to the fake news, so I'll tell you, in Shaare Zedek, we have 1,600 nurses. Many of them did not finish planning their families. You know, many of them are characterized by large families, by many kids. They still want to become pregnant, and they heard that this vaccine, the Moderna and Pfizer vaccine, may affect fertility of females in males. This is fake news. mRNA, messenger RNA, cannot change the DNA. It's a product of the DNA. It does not work vice versa. It cannot change our genome. It could not have any teratogenic effect on the offspring, and it's safe to become pregnant after getting the vaccine. It's even safe to give the vaccine during pregnancy based on a scientific logic, but not based on experimental data, because there were not enough pregnant women participating in the phase 3 trials that were held by Pfizer and Moderna. So I would not be hasty to give it to a pregnant woman, although this is, according to the literature, considered safe, but I would definitely give it to someone in the fertility age who plans to become pregnant, even if she plans to become pregnant very soon after getting the vaccine. This is part of the fake news. There is no impact on the DNA. I would like to relate, I already got a question about autoimmune diseases. So it's true that vaccinations in the past elicited autoimmune diseases. This was ascribed to the adjuvant molecules, the usual vaccines, the live attenuated vaccines, and the killed virus vaccines, which are the traditional vaccines, in order to accelerate their impact on the immune system. They were fortified by different molecules called by the collective name adjuvants. And the autoimmune diseases that were quite rare, but we knew it, they did break out, they were elicited by these adjuvants. The messenger RNA vaccine are a non-adjuvated vaccine. It does not need an accelerator. The messenger RNA does the work. So again, the scientific logic and the data accumulated so far does not attest to any possibility of a new breakout of autoimmune disease as the result of the vaccine. So this is also part of the fake news. How long does the vaccine confer immunity? So first of all, let's discuss how long does the disease itself confer immunity. You all read that with many of the people who suffered from COVID-19, 3 or 4 months later, the titer, the level of antibodies goes down to below the level that be considered that confers immunity. If you go by this logic, if we are now at about 75 million people in the world that had COVID-19, let's say that 20 million out of them, it's an assumption, already had it more than 3 to 4 months ago. And if you measure antibodies in their blood, many of them will have no antibodies or very low level of antibodies. By this logic, we should have seen today hundreds of thousands of cases of reinfection, of second infection with COVID-19. Till yesterday, in the medical literature, there were anecdotal reports about a little bit over 100, 130 people who suffered reinfection. What does it say? What does it mean? It means that probably the disease confers more than the immunity, the usual immunity expressed by immunoglobulins, by antibodies. Probably it elicits the cells called T lymphocytes to develop a memory that will confer the immunity for much longer than these few months. And this was measured in the laboratory, and that's the only logic that can explain why don't we see a second epidemic of reinfections among the tens of millions of people who already sustained COVID-19. So I will be calm about that too. And the question arises, of course, how long should we be calm? Mutations, new mutations, should we need to get a vaccine every year? So the answer is maybe, we don't know. We have to continue following, but I think everybody who had during this epidemic had the disease should be calm that his or her chance to be reinfected are very close to nil. Will there develop a mutation that will not be sensitive to this vaccine? And as far as we know, and we already, even at Shaare Zedek, we already analyzed the genome of the British mutation. We found that about 1/7 of the new cases in Israel are from the British mutation. And we know that this mutation will be sensitive to the vaccine. And it's also easy scientifically to explain it, because what is a mutation? Look, the spike protein, these weapons of the virus, the spike protein is composed of more than 100, couple of hundreds of amino acids. These are the components of every protein, of every peptide. The mutations that were discovered so far are few amino acids away. Few amino acids were changed. So again, the scientific logic says that if we have a protein here composed of couple of hundred of amino acids and 3 or 4 of them are changed in the mutation, this will not change the sensitivity of the virus to the vaccine. So we should be calm about that too. Of course, the more the disease is more spread, the more vaccinations we give. That's the natural development in a virus. It will try to avoid the vaccine and develop a new mutation. So the worst scenario that I see is that it will be like the flu, where every year we have new mutations. Every year we need to develop a new vaccine. But there are good news regarding these new vaccines, because as opposed to the traditional vaccines with attenuated live viruses or killed viruses, where every year scientists have to try and predict which mutation of the flu will prevail next year in order to produce the vaccine. The mRNA technology, which is really genius. I believe that these two Turkish scientists should get the Nobel Prize this year or next year for the mRNA technology in vaccines, in vaccinations. According to this messenger RNA technology, within a couple of weeks, scientists can prepare a new vaccine that will be efficacious against any new mutation. It's